Next on the agenda, Chair Liebling, House File 2339. And then Chair Liebling, I understand that you have a DE amendment. Can you reference that for us and then proceed?
Yes, I do, Mr. Chair. Thank you for hearing the bill today. So we have the DE1 amendment. So I do want to say that this is a project that helps to address the shortage of healthcare workforce. And it does it pretty quickly and directly. So the group that is coming with the proposal is a nonprofit in Rochester. And we don't have a lobbyist working with us, so we're working with the CA, Jenny Nash, has been very kind in giving me guidance, and so it's been a little bit of an iterative process. So we actually have two related bills, one of which is now in the Workforce Committee with the non-bondable costs. What is before you in the amendment is just a more fleshed out version of the same bill with the same amount of money in it as the original bill. So,
Thank you, Chair. Please proceed with your presentation.
all right, so anyway, thank you, Mr. Chair. I really, as I said, workforce issues are really severe, as you just heard in the previous bill. But this is a bill that's about training all kinds of workforce for the healthcare field. And it's a very important project because it's being run and centered in a nonprofit. It's a very grassroots project. And so I'm going to turn it over now to my testifier, Julie Nigan from GRAUC. She's the executive director, to explain more about the project.
Welcome, Director. Please identify yourself and proceed.
Hello, thank you, Mr. Chairman. My name is Julie Nigan. I'm the Executive Director of Greater Rochester Advocates for Universities and Colleges, better known in the Rochester area as GRAUC. GRAUC is a nonprofit that has linked education providers with employers to advocate and promote a skilled workforce for southeastern Minnesota for the past 36 years. In 2020, as a neutral organization, GRAUC was asked to unite public and private educational institutions, employers, and experts in design and technology with a goal of establishing a simulation center to upskill the current healthcare workforce and to prepare the future healthcare workforce. Since 2020, when the Simulation Collaborative was formed, we have completed a needs analysis, a business and governance plan, and a co-design process to address equity, inclusion, and diversity. I must say I'm particularly proud of the healthcare professionals, the diverse healthcare professionals from the Rochester area who were the co-designers on this project. Not only did they address issues relating to their ethnic groups, their religions, but as a group, they strongly came out in favor of building a curriculum and training healthcare employees in the best ways and most effective ways to work with the LGBTQ community. And I'm very proud of them. We are hoping not only to have that curriculum available to our healthcare workers, but also make it available to other simulation centers around the state. We've also explored curriculum, space design, technology, and possible locations. We urge you to make an investment in the Simulation Center for Southeastern Minnesota and to partner with us to train and prepare our nurses and other healthcare professionals who serve patients now and in the future. Thank you.
So questions. Chair Liebling, you need closing comments.
Yeah, thank you, Mr. Chair. So I don't know how familiar folks are with the simulation center concept. This is something that does happen now, but this is how it helps to accelerate the training of healthcare professionals, not just nurses, but at all levels, by allowing folks to practice in a simulation setting. So this is not only for nurses, it's for everyone all up and down the hierarchy of healthcare, if you will. So that's why it's important that it's centered with GRAUC, because and I think you might have a letter from Hawthorne Adult Education. They train a lot of, some of this is bringing people into the workforce for the very first time, giving them an opportunity to practice without real patients, but being able to hone their skills and accelerate their training. So it has a really, it's a very important kind of missing link for healthcare, and could be very important for the future of the state in terms of getting more people into healthcare that we desperately need.
Chair Liebling, we do have a question for you. Representative Scrava.
Thank you, Chair. Sorry I didn't get you fast enough. Are there other hospitals or centers that have simulators?
Director or Chair?
Yes, there are. Mayo Clinic has one very large center and a smaller center at St. Mary's Hospital that serve mainly of their healthcare staff, particularly their doctors and medical students, but also some of their their nursing staff. There's a small center at RCTC that is at or beyond capacity, as also a very small center for Winona State. Both of those centers are small, and it was actually Winona State who came to us and said, we need a center not just for Winona State, not just for RCTC. We need a center that serves all the nursing professionals who are being trained in Rochester, because we don't have space for them. And one center that is extremely high-tech. We have Mayo Clinic staff from the Sim Center helping us plan the current technology and also looking to future technologies to serve not only public universities, but private colleges and universities, K-12s, and adult education.
Representative Scrabble.
Thank you, Mr. Chair. So the Mayo doesn't have space for people to come and use, like time slots available?
That is correct.
Director.
All right, thank you, Chair.
Yeah, and Mr. Chair, so this is not really to serve Mayo Clinic as such. Mayo kind of has its own thing. This is for the rest of the community, as you heard from Ms. Nigan. This is, you know, much more broadly needed. And, you know, Mayo just doesn't have the excess capacity to be letting everybody come in and use their facility.
Thank you, Chair Liebling.